extra cash while being involved in groundbreaking research?
Well, here to explain what to expect when you take part in clinical trials and what trials are taking place right now is Dr. Basim Maximos from Centex Clinical Studies. Okay, so doctor, first of all, what exactly is a clinical trial?
A clinical trial is basically developing a medication before it becomes released to the public. So the pharmaceutical companies will seek patients or subjects to participate in trying the medication out for a period of time before it becomes FDA approved and released to the public.
And you need all kinds of participants, right? I mean, and is it true that every single person involved in the study would be on a medication, or could they be given a placebo?
Some trials, the patient can be given a placebo if it's not going to affect their health or the outcome. For instance, if we're doing a birth control trial, we're not going to give anyone placebo because they could apparently get pregnant if they're on a placebo.
Right.
So we protect our subjects and we protect the patients and make sure if they're involved in a trial that has a placebo, the placebo is not going to negatively affect them or lead into an outcome they don't want.
And there can be some compensation for the patient.
Absolutely. All patients are compensated for their time and their participation, not just by stipends, by dollars. They also receive medical care, they receive a physical, they receive the medications for free, and regular checkups during the time they are enrolled in the study.
Wow, so it's not just the medical care that's directly involved with being in the study, they're getting their overall medical care to ensure that they're healthy during the process.
Right, we monitor all the patients very closely, so we want to know if anything develops during the time they're on the medication, so we watch them very closely.
So let's talk about some of the trials that you have going on right now. One that has to do with postpartum depression, and that's a big issue for a lot of women.
Absolutely, and as an obstetrician gynecologist, I'm very excited about this particular trial because postpartum depression can affect 1 out of 7 women after having a child. So it's something very serious, and a lot of women suffer from it silently. So we're participating in that trial for developing the very first medication that targets postpartum depression and try to help these women during that tough time.
I mean, what's cool about this too is that if you're participating in the study and you can help bring a drug to market, you're helping other women who are experiencing postpartum.
And helping yourself, because a lot of these women have feelings of hopelessness and depression and anxiety, and they don't get to express it. So during that time they're enrolled in a trial, we help them through that time, not just by medication, by other ways to get them help.
And we put up some symptoms of postpartum depression. Now, would somebody have to already be diagnosed with postpartum depression before applying to get into the clinical trial?
No, we actually do the screening for the trial as well. So we encourage anyone that feels they are affected by postpartum depression or having a hard time taking care of their baby or getting back to their normal to contact us, and we'll screen them for the depression and see if they qualify for the trial or if we can get them help.
What's the time frame? What's the time commitment?
Anywhere up to 6 months after having the child. So postpartum depression can develop anytime within a year after having a baby. So our study targets women within 6 months of having a child.
And you're looking for women between the ages of 18 and 45?
Correct. Correct.
What should someone, if they were to participate in the study, what should they expect from the process?
Okay, so they expect the compensation, a little over $1,000 to complete the trial. They also can expect a full exam. Also, we screen for infections. We do a free pap smear, and we do some basic blood work for general health screening.
Okay, so let's talk about another trial that you have going on, a contraception trial. That's not easy for me to say, apparently. Okay, now this is not one where you're going to be given any kind of placebo, correct?
No, this one doesn't have a placebo. So this one is exciting too, because a lot of women on their birth control pills, they're not happy with it. So we're always looking for newer methods of contraception, newer pills that we can decrease the side effects of these pills so women can be more comfortable taking it long term and stay on it.
So it's not one of those if you're trying to conceive. This is if you're on
This is if you're already on a birth control you're not happy with, or you're looking for something newer and better to be involved
because there's so many side effects from
Absolutely.
the pills.
And, you know, and nowadays we're always looking to decrease these side effects. It's not acceptable anymore to have to deal with these side effects just not to get pregnant.
Right.
So the pharmaceutical companies and the major ones are looking at several ways to decrease the side effects and to develop methods that are more acceptable to women, that agree with their lifestyle, that don't set them back or help them decrease their menstrual cycles and their downtime every month.
Well, because like on the pill, you know, a lot of women complain about that they gain weight, that they have low energy, and so kind of give you a little bit more details of how somebody would get in on this trial.
So it's simple. To get on the trial, just give us a call and we'll do the screening examination for the trial and we can get you on it. In terms of the side effects, we're experimenting or we're testing lower hormonal levels. So the less the hormone the woman is getting, the less the side effects in terms of headaches, weight gain. We're also trying to target the menstrual cycle to make it shorter and lighter for these women, so their cramping and their pain and their bleeding every month is less.
Dr. Maximus, thank you so much for stopping by.
Yeah.
And for more information on how you can get involved with clinical research trials, you can call 281-918-0048 or check out Centex online at centexstudies.com. And Dr. Bassem Maximus, thank you.
Thank you so much. Thanks for having me.
Running